Now the dock and ride is using any existing joystick from any chair. We're not providing the new joystick, it's just a different way to attach it. And my initial example that I use for people is, and this is why I consider this more of a rehab product, the Duchenne's muscular dystrophy client. When you assess, generally speaking, you're dealing with a fixed thoracic kyphosis that you can't really correct. If you try to force correction to get to an armrest mounted drive control, you're creating generally a rotational scoliosis, and you've changed their visual plane, and you're putting them in a disadvantage for functional driving. Being at midline has distinct advantages for that client, and even for the client who's contracted, the client who has limited range of motion. Parkinson's patients who are closer to their core are more stable, all those clients. The problem is the methods of midline mounting have always had some compromises. They, number one, first and foremost, they flex, they move. So your drive control is in motion, not a great thing. The other thing about them is a tray or a Gatling mount, for example, would really almost be a de facto restraint in your chair. You can't move them out of the way yourself. So what our system does is gives you a solid, robust position to stabilize yourself at midline that's easily removable. So if you need to transfer, you can get out of the way. Now that same scenario is available on this with the side socket. Where it really shines, Rick, is when we use this as an attendant control. The running joke in the industry is, everyone struggles with attendant controls. They're very difficult to use, and I think we've quantified why. When you're driving with an attendant control, generally you're holding something that moves that's attached to another thing that moves. Makes it a little difficult to do. The moment that you engage with the device with your hands here, you completely gain a different level of control of the device you're operating. Makes total sense. And the beauty of this is we can do this on a chair that doesn't either have available expandable electronics or there's funding not available for that. So you can take a basic chair, offer attendant control without that extra cost, which could be a huge savings for the patient. But this can translate up to powering seat functions because we're using the existing drive control and controller that came with the chair. So we're not changing any of that. It's just a pretty elaborate way to connect the two.